Hello everyone, welcome to SWP channel. In this episode, we'll be talking about the climate change and its effect on global health. So let's start. Even as countries are meeting at the ongoing climate change conference COP27 in Egypt, a recent report by Lancet has traced in detail the intimate link between changing weather events and their impact on the health of people. The 2022 Lancet Countdown on Health and Climate Change. The theme, named Health at the Mercy of Fossil Fuels, points out that the world's reliance on fossil fuels increases the risk of disease, food insecurity, and other illnesses related to the heat. So, what does the report outline? As per the report, Lancet Countdown comes at a time when the world is face to face with the threat of climate change. According to the WHO, the World Health Organization, climate change affects the social and environmental determinants of health like clear air, safe drinking water, sufficient food, and secure shelter. The Lancet report indicates that rapidly increasing temperatures exposed people, especially vulnerable populations above the 65 years age and below the age of 1 to 3.7 billion more heatwave days in 2021 than annually in 1986 to 2005. So, how is it leading to rise in infectious diseases? The changing climate is affecting the spread of infectious disease, raising the risk of emerging diseases and co-epidemics. For instance, it records that coastal waters are becoming more suited for the transmission of Vibrio pathogens. It also says that the number of months suitable for malaria transmission has increased in the highland areas of the Americas and Africa. The WHO has predicted that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress. What about food security? So, report says every dimension of food security is being affected by climate change. Higher temperatures threatened crop yields directly, with the growth season shortening for many cereal crops. Extreme weather events disrupt supply chains, thereby undermining food availability, access, stability, and utilization. The prevalence of undernourishment increased during the COVID 19 pandemic, and up to 161 million more people faced hunger in 2020 than in 2019. This situation is now worsened by Russia's invasion of Ukraine. So the question is the world dependent on fossil fuel? The war has led many countries to search for alternative fuels to Russian oil and gas, and some of them are still turning back to the traditional thermal energy. The report argued that even if implemented as temporary transition, the renewed clamor for Coal could reverse whatever gains have been made in air quality improvement and push the world towards a future of accelerated climate change that would threaten human survival. Instead, a transition to clean energy forms would undeniably be the sustainable way ahead. So, further, the problem may arise like are there any solutions? But the report is not all gloom and doom. A health centered response to the coexisting climate, energy, and cost of living crisis provides an opportunity to deliver a healthy, low carbon future, it states. This is the way a health centered response would work. It would reduce the likelihood of the most catastrophic climate change impacts while improving energy security and creating an opportunity for economic recovery. Improvements in air quality will help prevent deaths resulting from exposure to fossil fuel derived ambient PM 2.5 and the stress on low carbon travel and increase in urban spaces would result in promoting physical activity which would have an impact on physical and mental health. The report also calls out for an accelerated transition to balanced and more plant based diets, as that would help reduce emissions from red meat and milk production and prevent diet related deaths, besides substantially reducing the risk of zoonotic diseases. The report indicates that these sort of health focused shifts would reduce the burden of communicable and non communicable diseases, reducing the strain on healthcare providers and leading to more robust health systems. This incremental notwithstanding, it is true that data shows that the pace and scale of climate change adaptation, planning, and resilience is insufficient. In this context, the report by Lancet calls for global coordination, funding, transparency, and cooperation between governments, communities, social society, businesses, and public health leaders to reduce or prevent the vulnerabilities that the world is otherwise exposed to. So, what is the conclusion of this Lancet report 2020? Or first, the 2020 Lancet countdown on health and climate change themed Health at the Mercy of Fossil Fuels point out that the world's reliance on fossil fuels increases the risk of disease, food insecurity, and other illnesses related to the heat. Second, every dimension of food security is being affected by climate change. Higher temperatures threaten crop yields directly, with the growth with the growth season shortening for many cereal crops. Extreme weather events disrupt supply chains, thereby undermining food availability, access, stability, and utilization. In this context, the report calls for global coordination, funding, transparency, and cooperation between governments, communities, civil society, businesses, and public health leaders to reduce or prevent the vulnerabilities the world is going to exposed. So, thank you